Presentation of dialogue on Idaho Public Television is made possible through the generous support of the Laura Moore Cunningham Foundation, committed to fulfilling the Moore family's legacy of building the great state of Idaho.
Coming up, it's been hailed as a victory for the common good and attacked as an unconstitutional financial disaster. That would be the new health care law, and we'll talk about it and take your questions next on Dialogue. Stay tuned. Hello and welcome to Dialogue. I'm Marcia Franklin. A welcome as well to those of you tuning in on public radio and the World Wide Web. For over a year, our country's been engaged in a national debate, or some would say a national argument, over health care reform. Well, whether you like the results of that debate or not, on March 23rd, President Obama signed the most sweeping health care legislation in our country since the 1960s. The act does many things, and we'll discuss some of those provisions. At its core, though, it does this. It requires almost all Americans to carry health insurance or face a tax penalty. It's that mandate that Idaho's Attorney General, along with 13 of his counterparts in other states, thinks is unconstitutional. Many legal scholars think the law will withstand that challenge, but it will undoubtedly take years to sort it all out. Meanwhile, the act is the law, and with me to talk about some of the near and far-ranging effects of the legislation are four guests. Karen Early is the Director of Corporate Communications for Blue Cross of Idaho, which insures nearly 600,000 people in the Gem State. Welcome.
Thank you.
Dr. Ted Epperly is a family physician and the director of the Family Medicine Residency in Idaho. He's also the chairman of the board of the American Academy of Family Physicians, which represents more than 94,000 family doctors across the country. Thanks so much for being here.
My pleasure.
Steve Fredrickson is the owner of Fredrickson Health Insurance, which has been providing health insurance services for 30 years in the Treasure Valley. It's good to have you here.
Thanks, Marcia.
And Jim Wordelman is the state director of AARP Idaho, which has 180,000 members in our state. Welcome.
Thank you.
Now, do you have an opinion on the health care law or a question about how it might affect you? Give us a call, toll free at 1-800-973-9800. First, I want to get at kind of a sense of the group here, a quick round robin on how you're feeling. Were you, give us your sense, were you watching the debate the day that the health care law was passed, or?
Well, yes, I was, and I was, well, not happy to see that the way that it did pass. We in the health insurance industry recognize that some of the reforms, the way they've been put in place, are not going to result in the kind of insurance that people think it is, and the costs are no doubt going to go up, especially in Idaho, where we currently have the lowest health insurance cost in the country, and our costs will go up, and there not as many people will have insurance as is envisioned by the plan. So we're very concerned that the legislation also really did not address the real driver costs here, which are the cost of delivering health services themselves. That's really important.
So you weren't hooping and hollering
No,
at the TV screen?
Not really, because we don't think that the results will be what is envisioned.
Dr. Epperly.
Marcia, I'd say that it's not a perfect law, but it's a good starting point. We can't have the perfect be the enemy of the good. I think long-term, looking at patient care over time, this will be very good for not only the people of this country, but the people of Idaho.
Were you watching as it was being debated?
No, I was busy doing other things, but I was in great hopes that we would step forward with meaningful health care reform at this time, because if we don't, the cost of health care going forward will implode the economy of this country.
So you saw it as a momentous day?
I think it's a very important day for America.
Mr. Fredrickson, you sell health insurance and have been doing so for 30 years.
Well, we certainly have a cost problem in America. Runaway costs in driving health insurance premiums up. I don't think this law does anything to help with the cost problem. Our job is to help connect the citizens of Idaho, businesses, and individuals with health insurance plans they can afford. I'm concerned that these premiums by the year 2014 for many people are going to triple. They're going to no longer be able to buy a very high deductible plan. Deductibles are going to come way down and premiums are going to go up significantly. Medicare is going to see huge increases as the government peels back on the Medicare Advantage programs. Could be 25 to 35% each year going forward for the Medicare Advantage participants in the state of Idaho.
Mr. Wordelman.
from AARP's perspective, we were very excited to see this passed. We've fought long and hard for our members and what our members want throughout the United States. We have 38 million members here in Idaho, 180,000 members. And so we've canvassed them, surveyed them, and we looked at what they were looking. I was following this very closely, not on TV because I didn't have access, but I had access to BlackBerry. And our BlackBerries were buzz 2 days before and during the whole thing to find out what the next steps were and what was going to happen. Healthcare is something that is very sensitive and very particular to each of us. So, it is difficult for every one of us to understand it because it is very complicated. But we're excited because it has some provisions to protect Medicare and actually expand Medicare, close the Medicare prescription drug donut hole. So we're excited about what's going on, and we've been getting a lot of really positive calls about healthcare reform passage and what that means for older Americans, not only in Idaho, but across the nation.
So some divergent views, obviously, and those were reflected on the floor of both the House and the Senate. I want to delve a little bit more deeply into something I said in the introduction, which was the individual mandate. This is a big change for our country, and we have a graphic here. By 2014, U.S. citizens and legal residents must have insurance or they'll face fines. It's a small fine in 2014, $95 or 1% of taxable income, but it does ramp up, $325, and then in 2016, a $695 fine or 2.5% of your taxable income, whichever is higher. And then I'd like to show some of the exemptions. I think people may not realize there are some exemptions. Not every single person is going to be required to have insurance. If you can show financial hardship, if you have a religious objection, if you're an American Indian, I think they're covered by the Indian Health Service. If you're an undocumented immigrant, which is of course quite controversial, you won't be able to, you won't have to get insurance. If you're incarcerated, obviously, you're not going to be required to pay for your insurance. If you're below, I believe we have another graphic to show this, if you're below the tax filing threshold, obviously you can't be penalized on your taxes, so you're exempt from that. But if you are poor, you're going to be given some opportunities to purchase insurance if you like. If you're without coverage for less than 3 months, nobody's going to bother you about that. And if the lowest cost insurance you can find exceeds 8% of your income, you are also exempt. So I wanted to get that out there. But really, this is a huge change in our society. Some have called it, socialistic. What's your sense about the philosophy of requiring every American to have health insurance, Doctor?
Marcia, I think that you can't really do this if you don't have an individual mandate. The reason for that is that everybody, or as many as possible, must be put into the pool. By doing that, you prevent the cost shift that happens from those without insurance. What happens if there's a cost shift is those without insurance then have costs that are charged from the doctor to the hospitals, to the insurance companies. Premiums go up.
You're talking about all of the people who have insurance now paying for people who go to the emergency room who don't have insurance.
And what that figures out to be is about $1,000 per policy. So if you have this cost shift happening across the country, then actually what it does is it increases healthcare costs.
Well, the problem is it's actually going to make that cost shift even worse. And the reason for that is that while health insurance companies supported the concept of an individual mandate, without actual teeth and a real serious bite, a penalty that's meaningful that goes along with that mandate, there's no way that it can work. And with the pre-existing exclusion, which we haven't talked about there, but pre-existing exclusion plays into that. And the reason it plays into it is like this. If you can make this akin to auto insurance, let's suppose that you didn't, while there's a requirement to have auto insurance right now in most states. The rate of people having auto insurance is about the same as the rate of people having health insurance. But let's just pretend you could have you could buy your auto insurance the day after you had a wreck. You didn't have to carry it. You'd have a penalty that was small, frankly, $695, which is about the 2% rate for someone with about a $35,000 income. So at $695, maybe that's 2 months of premium. You could pay the penalty of that and not carry insurance.
So what
but
you're
you
saying
you had a car wreck, and you could buy the insurance the next day
so
for the car you just had.
Is people might wait till they get sick.
They absolutely
to buy
will.
Insurance.
They will pay the penalty and wait till they get sick, and that undermines the entire concept of an individual mandate.
So bringing more people, if the fines were higher, do you think it would help?
If the fine were more significant and so that it was more meaningful, that you had, yes, significant fines that make it so that it would be better to carry insurance than to not carry insurance. That would make it work. Without the fines, all the research is done. There have been multiple studies that have said that as many as 90% of young adults up to age 35 will not carry insurance. They'll pay the fine instead. And that's certainly going to undermine it, because it's the young, healthy people coming into the system to help provide insurance and provide money into the system that's to help balance off those the coverage.
And this is the philosophical debate that we've been having in the country. If you bring more people in, will costs go down? If you bring more people in and you remove the pre-existing conditions, which is what you're talking about, will costs go up?
Well, bringing more people in will make costs go down. The problem is you won't bring more people in unless you have a more significant penalty.
Let's take some phone calls. Mark in Boise. Mark, go ahead, please.
Well,
hi.
I'd like to ask each of your panelists if they agree with Governor Otter and the legislature in taking the federal government to court, and if they believe that it's the correct way to do things, tell us why. And if you do not agree, tell us why not.
Okay, thank you very much. We'll start with you, Mr. Fredrickson. Do you like the idea of suing the federal government over this?
Well, I think I was very proud to be an Idahoan when Idaho was the first state to step up and stand up against the federal government and their takeover of some of our rights and ability to have our independence of what we're buying. And I think it was the right thing to do.
Mr. Waterman?
I don't think it was the right thing to do, because we don't know what the implications might be for Idaho in the future. There's potential that it might have implications in other areas where we're getting federal funds. We're really concerned that it might have impact on Medicaid and the Children's Health Insurance Program, which right now we're talking about $1.6 billion, which is a huge amount of money, and we'd hate to see that go away just because we don't require this.
Ms. Early?
Well, we think that every state should have the right to make decisions about how its citizens receive its health care. So in that respect, that we think that this, certainly the state was within its rights to say we'd like to make those choices and not have it be a federal decision.
Doctor?
I think health care is not a Republican issue. It's not a Democratic issue. It's not an Idaho issue. It's not a Montana issue. It's an American issue. And quite frankly, for this all to work for the betterment of the nation, we must come together around health care. Medicaid, which is care for the poor, aid for the poor, is a shared program. It's shared between the federal government and our state. To make health care work the best takes synchrony between the states and the federal government.
And of course, the states that are suing are saying that this isn't a sharing program, that they're being forced to do something, mandated to do something without the money coming along to pay for it.
But there are subsidies that help people without means, up to 400% of the federal poverty level to help those folks.
Which is interesting. It's 400% is something like $40,000 for an individual. Let's take some phone calls again and hear from Howard in Rexburg. Howard, go ahead, please.
I'd like the definition of what's defined as a Cadillac plan. For example, if a fairly good policy that costs about $1,700 a month, is that a Cadillac plan? And does that mean that in 2016 that we'll have our 40% excise tax on that amount?
Thank you very much. Certainly this was one of the elements that almost hung up the whole bill, and it's one of the last elements to go into effect, the so-called tax on Cadillac plans. Very expensive plans that provide a lot of service. Can anyone answer that question?
I think that's one of those issues that's going to become regulatory, that's going to be defined by the regulations, Steve.
It says for family coverage in excess of $27,500 per year, so $1,700, or single coverage in excess of $10,200 would be subject to the 40% excise tax. But that's not until the year 2018.
Right.
So $1,700 premiums would be pretty common by the year 2018.
Oh,
so it's way out there. But in the 40% tax, as I understand, is paid by the insurance company, not by the taxpayer.
And it has been very controversial. Unions were very opposed to this part of the provision, and there's several election cycles before that goes into effect. So that may be one of the things that gets modified down the road.
Marcia, it's important to understand why
Why
this
they did
became
this, yeah.
a provision. And what's found with Cadillac or expensive plans, which would be over $2,000 per month premium at $27,000 for a family, is that the more coverage you tend to have of all types, it tends to drive utilization of health care. So that the more you've got, the more you spend. And so part of the issue with looking at the expensive plans that cover everything was, how do we go ahead and reasonably price this so that we can control health care expenditures? The larger plans spend more.
Let's take another phone call from Ed in Boise. Ed, go ahead, please.
Hi, I'm self-employed, and I'm wondering, how does somebody like me get along with insurance when I can't afford insurance? Because the president mentioned in one of his last speeches how the insurance companies like Blue Shield and that, or Blue Cross, are getting so expensive that they raise your rates 35-40% on a yearly basis. And that has put me out of the market for insurance. So what do I do?
Well, thank you for your call very much. A huge part of this bill is assistance to people to purchase insurance. And to the individual who just called, there's going to be subsidies for people between 133% and 400% of poverty, as we just said, which actually is a pretty high amount. And insurance exchanges will be set up so that you can go and see what's out there and kind of shop around. And we're not quite sure, we were talking about this before the program, we're not quite sure how that's all going to work. But the idea is you'll have a lot more choices, and you will get subsidies from the government depending on your income to help you with that. And also Medicaid will be expanded. And this is quite controversial because the states are also suing on this provision, feeling that too many people will flood Medicaid. So that's the best way I can explain it.
Well, one of the things you have to remember about Idaho, and this is, while people aren't necessarily aware of some of the programs that Blue Cross of Idaho in particular, and it offers very low cost insurance. We have insurance if you are a male at age 20, I think you can get insurance as low as about $60 a month. Now as you get older, the insurance becomes more expensive, that's true, but at the same time there are a lot of programs that are available to a lot of people to offer insurance. When we have done some actuarial analysis of what happens when these laws become effective, and the bronze plan, there's a bronze, silver, and gold plan envisioned in these state insurance exchanges, and right now, when we did our actuarial, the insurance that we would offer at about a little better than $100 a month, under the state, the way that it's envisioned, it has to be priced according to the rules set up in this legislation, it would be over $250 a month. So the prices will go up. You will need those subsidies, as Steve has mentioned earlier. You're going to need those subsidies because the prices of insurance are actually going to increase. In Idaho in particular, where we have the lowest cost insurance in the country, it's correct, people going across state lines are going to be looking to a state like Idaho where the costs of insurance are so low. They will be going up here if we continue to, if these regulations continue to promulgate the insurance the way it's envisioned.
Do you think self-employed people will be helped by this legislation?
Absolutely. That's why it was envisioned. Part of why healthcare reform came about was to help individuals, small groups, self-employed people be able to afford insurance. The last caller nailed it. He's seen premiums go up, which is pricing him out of the market. What needs to be done, and what was done with the passage of this law, is to help bring down costs so that folks like he can afford insurance. The problem is that the leading cause of personal bankruptcy in this country is from health care bills. It's added so much to small businesses that they can't afford to cover their own employees. That's part of the issue here. And in fact, to just what was said, I would think that Blue Cross or Regents Blue Shield would be happy to see what's happened because it's going to bring more business into the state of Idaho.
And that was a big question for me. I'll ask that of you as well. You sell insurance. Isn't this a good thing for you? You're going to get more customers.
Well, more customers would be great, and in theory, if we got paid the same for what we do now and we had more customers, from a business standpoint, our business would be going well. But we're way more concerned about the people we're serving and what it's going to do to the businesses, to their financial statements, with all now their unemployment taxes are going up. They got Social Security taxes, Medicare taxes. Now they're going to have health insurance taxes and penalties. It's becoming outrageous to the cost of a business. And our job is to try to help them find affordable insurance so they can provide benefits to their employees, and race employees can afford. These employees salaries are not going up, especially now. There's freezes all over the place, and as employers get hit with higher premiums, so Marcia, yeah, we're going to have more business potentially, depending if we get involved in it, but we've got to work with these people to try to control their costs. Our job becomes a lot harder.
Let's take a call from Marcia, who spells her name like I do, yay, in Rexburg. Marcia, go ahead, please.
I have a son who has hemophilia, and because of the cost of his medical care, by the time he was 16, he had used up his lifetime cap of our Blue Cross insurance. My husband and I are both teachers, and I'm wondering if under this new law we will be able to reinstate him in our insurance. He's been struggling for insurance for quite a few years now. He's 20 years old.
Thank you very much for your call, and I think this would be a good time to take a look at a graphic that we have about things that start by the end of 2010, and this relates to that. By the end of 2010, children with pre-existing conditions cannot be excluded from insurance. Then secondly, your question, lifetime limits on coverage will be banned, and that's by the end of this year. Coverage cannot be rescinded except for by fraud. Dependent coverage for children will exist up to age 26, and some preventive care will be fully covered. To her specific question, I think we've just answered it. Lifetime limits, bans on lifetime limits will be removed.
Correct.
And that would help in that situation, but her son has a pre-existing condition, and that part of the bill doesn't go into effect for a couple years for adults. I assume he's considered an adult because he's 20 now. So would he be able to be insured even though he's used up his lifetime limit because he has a pre-existing condition?
That's a regulatory question I'm not able to answer, but I can tell you that right now that he could get insurance through Idaho's high-risk pool.
Right.
Which is something that is envisioned. Many states don't have a high-risk pool. A lot of things we're doing in Idaho are very, very good. This high-risk pool enables anyone who has used up their lifetime limit and can't get insurance somewhere else to obtain coverage at a very reasonable rate.
Let's look at the second part of that graphic for 2010, because you said, we do have a high-risk pool, but federally, these temporary high-risk pools for adults with pre-existing conditions, like this man with hemophilia, will be put into effect by the end of 2010. It's the next graphic. And then we'll have tax credits for insurance to employers with fewer than 25 employees. And then something I know you're very interested in, the $250 will be sent to Medicare recipients who are trying to deal with this prescription gap, so-called donut hole. But there you see that temporary high-risk pool for adults with pre-existing conditions will be set up by the end of 2010. And I know from talking to the head of the Department of Insurance, Bill Deal, this is his prime focus right now, to Marcia, who called from Rexburg, is making sure that our current high-risk pool complies with the new federal regulations so that people like your son can enter it. So I would stay in touch with the Department of Insurance on that. They're waiting for some regulation. You
can go on the Department of Insurance website right now and find the insurance, the rates that it's offered at, and the insurers that do offer it.
Right, and let's talk about the Medicare situation, because the AARP pushed for that, and this so-called donut hole, which is kind of a gap for people who have spent over their limit, that they're going to get a $250 check in the mail? Is that how that's going to work?
Yes, this is really important to people who are Medicare beneficiaries and on Medicare Part D prescription drug. When they get to a little over $2,800 on their out-of-pocket prescription drug coverage, then they fall into a gap where they have to pay all of their prescriptions up until about $4,800. And for 2010, everybody who falls into that gap will get a $250 one-time check to help out. That's in 2010, and it'll be given on a quarterly basis. In 2011, it changes so that when someone falls into the donut hole or the gap area, they'll be getting 50% off of their brand name drugs, 7% off of their generic drugs. But this is scheduled to go on, eliminating that gap coverage until the year 2020, where it's completely eliminated and people will only be paying 25% of their prescription drugs.
While we're talking about Medicare, a lot of the debate on the floor of both the House and the Senate was about how Medicare is going to be gutted. part of what they're talking about is the subsidies to these so-called Medicare Advantage plans, which have existed for the last couple of years, will go away. People were very fearful, and this is something that's out there. What does AARP tell its members? Is Medicare going to be gutted? What about the Medicare Advantage plans?
Medicare is not going to be gutted. It's in fact going to be enhanced and improved. We're looking at, and the new law is looking at enhancing Medicare. What's happening with Medicare Advantage plans is those plans are plans that are through private insurance companies, and they actually pull down 14% more from Medicare than the traditional Medicare plan. They also usually...
The government's been subsidizing them.
Yes, government has subsidized them over the years.
Do you think people will still be able to purchase them once this goes through?
Well, it's been kind of a bait and switch, Marcia. The government got a lot of people to sign up for Medicare and we gave them a great deal. Now, due to budgetary constraints with Medicare is big time upside down on their budgets. And so they've decided to take out $206 billion out of Medicare over the next 3 years. In Idaho, for Medicare Advantage programs, that's going to be a 25 to 35% increase for those people that want to stay on their Medicare Advantage plans for each of the next 3 years. So people that are now paying approximately $100 will see more than double that premium over the next 3 years. And that's a big deal to senior citizens. Way more than the donut hole savings. They're going to get really hit hard on the cost of their Medicare Advantage premiums.
Very briefly, there's obviously a disagreement here.
One of the things with Medicare Advantage is those plans do offer more things than the regular traditional Medicare programs, and the insurance companies are at liberty, and they have this year cut back on some of those things. And so another important consideration before going into Medicare Advantage program is once you're in that program, if you've been there for a while, it becomes increasingly more difficult to get Medigap insurance.
That's under Blue Cross Vital. That's absolutely not true. We will transfer people with Medicare Advantage to a Medicare supplemental without any age rating. They simply can change the type of coverage that they have. So it's absolutely not true. At least for my company, it's not.
We've only got a minute left. So fast. Those of you holding on the line, stay on the line. We will answer your questions off the air and put that on the website. We have a great website with lots more information on this topic. Really, it's wonderful. So I'd encourage you to check it out at idahoptv.org, and then you can click on Dialogue. Real briefly, let's wrap up with the two of you. 10 years from now, if we come back, we take a look at this, what do you think?
I think you're going to see a lot of people still uninsured. I think you're going to see the prices have gone up on healthcare premiums considerably. There certainly are some changes that may result in people having easier access to care in some respects, but the cost will be so high and that not as many people will have insurance as you might expect.
Although frustrating and different people see it different ways, I totally see it differently. There will be expanded coverage to 32 million more people. Premiums will come down. Every country, every industrialized country on this planet has seen healthcare improve with exactly what we've started right now. It'll be good for America.
Well, we can see that we have a great variety of opinions here. Nobody has a crystal ball. We will continue to follow this with many programs on this issue. I thank you for being here. Again, to the callers, please stay on the line. We'll answer your questions. And please go to our website for more information on this very interesting but complex topic.
Presentation of Dialogue on Idaho Public Television is made possible through the generous support of the Laura Moore Cunningham Foundation, committed to fulfilling the Moore family's legacy of building the great state of Idaho. To order a copy of this program from Idaho Public Television, call our toll-free number or visit us on the World Wide Web.